Good afternoon. Welcome to the media who are in the room today and to all those watching online. Hello. Today, Dr. Morrison and I will provide an update on the measures happening in our schools as it relates to COVID-19. We also have on the line with us today Norbert Carpenter, Director of the Public Schools Branch, Gilles Arsenault, Director of La Commission Scolaire de la Langue Française, Dr. Tamara Hubley-Little, our Director of English Education Program and Services, and Mark Damone, Policy Analyst with the Chief Public Health Office. We are excited to be welcoming students back to in-class learning next week, starting Monday, January 31st. Dr. Morrison and her team with the CPHO have provided us with clear guidance on the best steps forward. And we are doing everything we can to facilitate a successful return to the classroom. I want to commend all of our teachers, educational staff, parents, and students. The past month has been challenging, but you have all risen to the occasion, so thank you. It's been wonderful seeing so many of our educational staff finding unique ways to engage their students. Compass the other night had a great segment on the Snowman Challenge happening with our EAL students. And last night, a teacher building an igloo in her backyard. I've heard about respite staff taking students tobogganing and baking, a bingo night happening at our school, costume Google Meets, virtual dance parties for gym class, and lots of creative ways our educators have gone above and beyond to keep students engaged. So again, thank you for that. I'm proud of how connected our students and our staff have been this past month. Our attendance numbers throughout remote learning have been extremely high. But today, we aren't here to talk about remote learning. We are here to discuss the reopening of in-class learning. We know that in-class learning is the best option for our students. It is the optimal learning environment, and it is where our kids get to see their friends and have these social interactions and opportunities, which are so important. Schools will reopen on Monday. In preparation for schools to reopen, tomorrow our teachers will continue to provide independent remote learning work. However, synchronous learning opportunities will pause to allow time for education staff to prepare. I will also note that our high schools typically would be in exams next week. The new semester starts on February 3rd with in-person learning. Virtual supports will continue next week as students finalize their end-of-term assignments and assessments. As students return to school, things will look a bit different. The CPHO has provided us with guidance on public health requirements for a safe reopening. Our department and our educational authorities, the Public Schools Branch and the CSLF, have put measures in place to implement all of the recommendations made by the CPHO. Parents and guardians should have received an email from their school administration yesterday with details on when and where they can pick up the testing kits and new masks for their children. Every student and staff person will receive 10 kits, 5 at the initial pickup this week, and 5 others will be sent home with students next week. The direction from health is for our students to test twice before returning to school, 48 hours apart, and then 3 times per week for the first 3 weeks of in-class learning. So for anyone going back to school on Monday, this means you will test on Saturday morning and then again on Monday before going to school. And after that, test on Mondays, on Wednesdays, and on Fridays for the next 3 weeks. We have developed videos that will be provided to school administrators. They're also available on the government website and will be promoted on social media. There are several videos, one you can watch with your children on why we test for COVID-19, and another is an instructional video on how to do a rapid test on a child, and one on how to test yourself, which may be relevant for our high school students. We recognize that this will be difficult for some families, but remember, testing is in the best interest of your child, their school, and the greater community. When parents pick up their child's test kits, they will also receive a new mask. This is a washable 3-layer cotton mask with a refillable carbon filter. We have both masks in pediatric and adult sizes, and they are adjustable. In fact, I have one right here. It's quite comfortable, actually. Students and staff should change their filter every 2 days. So when you pick up your mask, you'll receive multiple filters, and the school will provide additional filters to students as needed. We also have a supply of disposable triple-layer masks available at every school and on buses for students who misplace or need a replacement mask. Masks will be required at all times for both students and staff in indoor space or on the bus. There are a few exceptions, including when eating, being physically active, or where students have special mask exemptions on a case-by-case basis. We're also providing additional PPE for staff who work with medically compromised children. This includes goggles and face shields. I recognize that this is a lot. As a parent myself, I know these are challenging conversations to have with my 5-year-old, explaining the importance of testing and why he has to wear a mask all day. But I do trust our health experts. We are doing all we can to protect our children and our communities. I also want to take a moment and encourage parents and guardians to get their children vaccinated. Health PEI has clinics available for all ages, so please find a time and location that works for your family. Students are not required to be vaccinated to return to school, but we do strongly encourage it. When schools open next week, I would also encourage families who have the means to consider driving their children to and from school rather than sending them on the bus. It certainly will help to minimize the risk of exposure on our buses, especially those buses that transport children from multiple schools. As we mentioned previously, we are taking action on all the recommendations from CPHO to decrease risk of exposure at our schools. Unnecessary furniture has been removed from classrooms to support physical distancing. Cohorts of 50 or fewer will be required wherever possible. Students and staff are encouraged to select a small, consistent group of friends and colleagues to interact with. Portable HEPA filters have been installed in schools lacking mechanical ventilation. All schools will maintain their enhanced cleaning and disinfection protocols and, of course, their hand hygiene protocols. At this time, there will be no in-person gatherings or assemblies. School sports, however, can resume for practices and training. However, games and competitions to continue to be on pause. Group extracurricular activities may proceed if physical distancing can be maintained at all times. Even with all of these precautions, we know that there is still a risk of COVID being present in our schools, and we are preparing for what that might look like. Substitute lists are continuously being updated, including lists for teachers, EAs, bus drivers, and other essential staff. The Department of Education and Lifelong Learning has developed new at-home support models for students who are required to isolate and cannot physically attend school. These will include opportunities for both student engagement and academic achievement beyond what their classroom teacher provides. We will have live virtual elements with supports for language arts, mathematics, sciences, and English as an additional language. We will also be launching a new school messenger program where parents will be invited to opt in to receive text alerts from schools. These alerts will be used for emergency situations such as school evacuations or a bus accident, timely issues like early dismissals or possibly exposure notifications for COVID-19. There will be more details released next week on how parents can opt in to receive these text alerts. Our educational authorities each have a COVID-19 response team in place, as well as school-based response teams throughout the province. We will continue to work with the Chief Public Health Office and Public Health Nursing to support case and contact management when there are students and staff with COVID-19. Parents are asked to notify their school if their child has tested positive for COVID-19. That way, we can set up an academic supports for your students, and if needed, we can help support public health nursing with contact tracing. All school exposure notices will be posted on the PSB and CSLF websites, and emails will go to parents through our Power School database if their child is in a class or on a bus where there has been an exposure. Dr. Morrison will speak in more details about close contacts and what contact tracing will look like going forward. We will continue to support our early learning sector over the coming weeks. Benefits and government programs that are currently in place will be extended for an additional 2 weeks. This includes paying parent fees at early learning centers for children infant to age 4, regardless of attendance. In addition, we are providing up to $125 per week for those who choose not to utilize their regular childcare due to COVID-19 and are required to keep their child home and hire a private babysitter, or they are unable to access their childcare due to a closure or restrictions at the center. We are very grateful to have such tremendous early childhood educators and support staff. We so appreciate all the work you do to provide for our youngest and most vulnerable islanders. And so from the bottom of my heart, thank you. I know this is a lot of information, a lot to process, certainly a lot for me to say, but all of these details are on our website, and messaging will go directly to parents from their school administrators. Before I hand things over to Dr. Morrison, I do want to say a few words to our students. I know the past 2 years, and especially this past month, have been hard for you. You miss your school, you miss your friends, your sports teams, your teachers, and music class. You miss going to birthday parties, swimming lessons, and the local rink. Please know we are sorry you've had to go through this, and know that all the decisions we are making are to keep you healthy and safe. I think we all may have different opinions as a society on how this should happen and what is the right path forward. And while we disagree on some things, I do not think there is a single islander out there that wouldn't simply want what is best for our children of this province. And that is at the center of today's announcement. Everything we have done so far and everything we will continue to do in the future is for you, our students. So thank you again for your patience and perseverance. We will get through this. And hopefully this is a step towards normalcy for our students and our education staff. Now I'll turn things over to Dr. Morrison.
Thank you, Minister Jameson. Good afternoon. I actually think you gave great detail, so I'm not sure I'll have need to fill in very much. So I'm really pleased to be here this afternoon, really just to offer a few comments as we prepare for island children and staff to return to in-class learning on Monday, January 31st. There's no doubt the best place for children is to be in school. Research supports the benefits of attending school for the social, emotional, and physical development of children. We know that not being in school is having a negative effect on the mental health of some children. The pandemic has been challenging for everyone, but especially for children and youth. Social isolation and prolonged school closures have resulted in unhealthy behaviors, increased screen time, reduced physical activity, and national reports indicate healthcare providers are seeing increased depression, anxiety, eating disorders, and delayed development in children and youth. The decisions to have schools closed since the holiday break have been difficult and were made based on balancing health with the overall safety and well-being of children, knowing that there are negative consequences associated with school closures. We have taken a slow and cautious approach to school reopening. In most provinces, children are already back in school. We fully expect that there will be cases of COVID-19 in schools, given the number of unlinked cases and amount of virus circulating in our community. Despite our best efforts, PI classrooms will not be immune to COVID. Returning to school safely does not mean that schools will be free of COVID-19. But we are talking about returning as safe as possible to school. We have taken steps to ensure that the return to in-class learning is as safe as possible. We have a high rate of vaccination among children and youth. 64% of children aged 5 to 11 have at least one dose of vaccine, and some have already had their second dose. 85% of youth between 12 and 19 years are fully vaccinated. And we know that being vaccinated protects children from severe outcomes, such as hospitalizations and COVID-related health impacts, such as multisystem inflammatory syndrome. All children and staff will be tested twice for COVID-19 before returning to school, as Minister Jameson mentioned, using rapid antigen screening tests. They will be asked to test up to 3 times per week for the first few weeks of school. We have prioritized a portion of our supply of rapid antigen screening tests to support island children and staff returning to school. We have back-to-school guidance for January 2022 that includes enhanced measures to limit spread and outbreaks in schools. These enhanced measures are in response to the elevated risk of COVID-19 in the community. These public health measures include cohorting, masking, physical distancing, enhanced cleaning, daily active screening, and ventilation. For example, all students, staff, and visitors are required to wear masks in indoor areas, but mask exemptions include unable to wear a mask for health or behavioral reasons, unable to put on or take off a mask without assistance of another person, or when eating and drinking. So those would be examples of mask exemptions. Cohorting is required wherever possible from K to 9. Students and staff are encouraged to select a small, consistent group of friends and colleagues to associate with in school settings and on buses. Cohorting is not required in grades 10 to 12 due to class scheduling. Schools are asked to create as much space and room as possible between people by removing excess furniture from classrooms, avoiding face-to-face seating arrangements, managing flow of students in common areas and hallways, and minimizing crowding. Visitors will only be permitted in schools for essential purposes, and there will be no assemblies other than by virtual means. All students and staff will receive a good quality 3-layer mask, as Minister Jameson referenced, and the rapid tests prior to the school reopening. All students and staff would complete a daily home screening for symptoms of COVID-19 using the screening tool. And keeping our children and students home when they are ill and when they're feeling sick is really important, an important step to prevent illness spread and to protect our school community. And I think that's important to mention. In partnership with educational authorities, we have developed a process to guide case and contact management when there are cases of COVID-19 in schools. Unlike most other jurisdictions where they are not doing any exposure notification, we will be conducting case and contact management in schools. We will be working hard to maintain our ability to conduct monitoring and surveillance in schools. In terms of what parents can expect, parents and guardians will be notified if their child tests positive and will be asked to notify the school or the COVID education response team of this test result. Parents and guardians of children over the age of 12 will be asked to work with their children to notify close contacts directly or to inform the education response team of the contacts. The direct notification of close contacts by the positive case is the standard process in place for all PEI residents. Public health nursing will follow up directly with families of students aged 12 and under who are positive to identify close contacts. The names of close contacts will be forwarded to the education response team. The education team will send either exposure notification letters or close contact letters to families as appropriate. Children and staff who are exposed to COVID-19 but who are not considered close contacts will not be required to self-isolate and can continue attending schools and activities. They will be asked to monitor for symptoms and test daily for 5 days using rapid antigen screening tests. The tests will be provided by the respective school. Children and staff who are named as close contacts will be required to isolate for either 4 days if fully vaccinated or 7 days if partially or unvaccinated, and test at a health PI clinic before leaving isolation. They are asked to avoid high-risk settings such as as a child care facility for a total of 10 days from the beginning of their isolation. And depending on the age of the student, we always mention that a parent or guardian may have to isolate with their child. We've been asked, and we continue to be asked, what is a close contact? A close contact is someone who has face-to-face interaction within 6 feet of a person with COVID, indoors for at least 10 minutes over a 24-hour period. If both individuals wore a mask during the interaction, it is not considered a close contact situation. In the school context, close contacts might include friends eating lunch together across the table from each other without their masks on, seatmates on the bus if the masks are not worn properly, if they're taking them down and chatting to each other. One of the principals on a call this morning suggested another close contact might be two people who haven't seen each other in a long time and are very happy to see each other, and they may be meeting up and quite excited and to interact. So those would be close contacts without being masked. The education system will post all school-based exposure notifications publicly. The CPHO will receive updates regarding case and contact management in schools, including absenteeism, on a regular basis. Our office will also be monitoring severe outcomes, including hospitalizations, in this school-age population. We've been asked, how will decisions be made regarding when to close a school? And essentially, it will in large part be an operational decision. As much as possible, those students will remain in school, provided they are not a positive case or a close contact. The primary factors that will influence the decision to close a school include the number and proportion of students absent from school due to COVID-19, and the number and proportion of staff absent from work due to COVID-19. There will be regular consultation between our office and the education system to determine when it is necessary to close a school, either because of the number of students absent will have a significant impact on learning, or because the number of staff absent from work will result in an untenable or unsafe operational situation. Similar to adults, the best defense that children have against COVID-19 is to be immunized. I encourage parents who have not done so yet already to make an appointment for your child to be vaccinated and get second doses when they are eligible. Now is the right time for eligible children to be vaccinated. The National Advisory Committee on Immunization recently updated the recommendations for children aged 5 to 11 based on real-world data, given the safety profile and effectiveness of the Pfizer vaccine to protect children against hospitalization. And they really are encouraging that age group as well to be vaccinated. We have a solid plan to support the return to in-class learning, and it involves guidance and layers of protection. And as Minister James said, these are not easy decisions, but they're always made with the health of students and the overall health of students in mind. But going back to school is going to depend on everyone: students, staff, parents, families, those of us working in public health and in the education system to make it work. And I know students, or almost all, and parents, almost all, and probably staff, almost all, want to get back to school. And even if we don't have children in school, what happens in the community does impact what happens in the school. And we've said that previously. So I know it behooves all of us, everyone, to continue to do our part to keep schools as safe as possible. So thank you.
Very much, Dr. Morrison, and now we'll hand things over to our friends in the media, and just a reminder that we have a number of experts who've been working around the clock on the briefing today. So certainly, if we might direct some of the questions to them as well.
Allison Jenkins, The Guardian. looking to find out about students who have had their second vaccine. It's coming up to that time where they're getting their second vaccine. Will those rapid tests still be effective? Are they still the right thing to be doing even after you've gotten your second vaccine? It won't test accidentally positive?
Yeah. So I'll take that one. Yes. So the rapid tests will not be influenced by your vaccine. Okay. So even if you've recently had a vaccine, first or second dose, you can continue to test.
Perfect. Thank you. And are we concerned? Do we need to know if students are actually testing? How are we going to keep track of that to make sure that everyone's testing properly before they return to school?
Mm-hmm. Yeah, and certainly I think I'll let Norbert or Jill speak to this one.
Thank you, Minister, and thank you for the question, Allison. Absolutely, as Dr. Morrison has alluded to, we have a number of layers of protection. And for the public schools branch with over 19,000 students, we're not able to verify every single test that's coming in. So we know we have a high compliance rate for the CPHO guidelines, and we expect the vast majority of our students and parents will ensure these tests are completed. And so it's just another layer of protection. It will add to us being safe for school.
Okay, thank you very much. And my third question, if I may, is can you elaborate on the home support model that will be in place for students who have to isolate?
Yeah, thanks for the question. I think this one is a great one for Dr. Tamara Hubley-Little, who's our Director of English Education and Programs and Services.
Hi. I think that the department is providing quite a variety of extensive supports that we had not had in place previously. It's really important that everybody get back into school on Monday. Having said that, we will have a number of students over the coming days and possibly weeks that will be required to self-isolate. And so as a result, anticipating that, we have really three different layers of support. So for our youngest students in kindergarten through grade 6, we are offering daily live engagement sessions where students can participate with a certified teacher for a period of time. So those will be offered daily. And once a parent notifies the teacher that their child is self-isolating under the direction of CPHO, those links and information will automatically be sent to the parents. So in addition to that, we also will have a number of supplementary learning activities on the department website, again, available to students who are self-isolating. And these activities will supplement what the teacher is going to be providing in terms of learning materials. So if the student is self-isolating and they find that they have some time on their hands, once they've completed their learning materials from their teacher, they can take a look at these materials, these activities. They're really fantastic. We were looking at them yesterday, and I think parents and students will find those quite engaging. Our second support is for students in the academic area. So if a student is struggling or has a question about their classwork, then they can sign up on a daily basis starting at 8:30 in the morning for an appointment. There'll be half-hour appointments in length for support with their coursework. And some of those areas are science, math, language arts, supports for our English language learners as well. So when we take those three pieces and we put them together, we feel that those supports that are in place really will help the student while they're out of school, but also to transition back into school with great success.
Thank you very much.
Okay. Thanks, Tammy.
Brittany Spencer, CBC. Hi, thank you for taking our questions today. I was wondering, you just went over the home support model for students that are in isolation. Now, I know that you received questions, Dr. Morrison, yesterday about, what parents who may not be feeling comfortable sending their children back to school yet should do. I'm just wondering if there will be any options for families who decide to keep their children home.
Thanks, Brittany. Appreciate the question, and certainly one that's been brought to my attention throughout the last days and weeks. And I'll pass this one along as well to Dr. Tamara Hubley-Little for a response.
Thanks, Brittany, for the question. And this is something that's on the top of a lot of parents' minds. I am aware that this continues to be a concern whenever we've gone back into school. And we think about September of 2020, there were a number of parents who were quite concerned about their children coming back in. So now that we've been deemed to be going back to in-person learning, we do want children to come back into school. Our system is designed for in-person learning. We feel it's the most appropriate. Having said that, if families are concerned about their students being in school, their option is to apply to the Department of Education and Lifelong Learning for homeschooling. So what that means is they'll take responsibility for their education for the next 5 months. We can provide them with curriculum and textbooks, but I want to be really clear. We want children back in school. It's the very best place for them. And if children are anxious, there are supports at the school system through student services that can really help to alleviate that. So having said that, if parents opt not to have their children back in school, homeschooling for the next 5 months is available to them. Thank you.
About masking, and I'm just wondering, I know that students are going to be given one triple layer reusable mask to use in the classroom. Does that mean that other types of masks that they may have been using previously won't be allowed anymore?
Thanks for the question. I think, Dr. Morrison, this might be a good one in terms of the recommendation around masking.
Yes. Hi. I mean, I think it may also be a question for, I'm not playing hot potato with the question, but really because it'll be the schools who will be operationalizing the mask. It's really important to wear a well-fitted mask with multiple layers on it, and I think that's really the biggest emphasis that we've been trying to make, and important to wear one in indoor settings. And I know that we've spent some time sitting here talking about different kinds of masks. I think the mask that is being provided is a really good example of what can be worn, but it is not the only mask that parents may choose. They may buy other options. They might buy replacements, and they may want to use a medical mask. I mean, there'll be some different options. So I'd be interested maybe to hear from Norbert or Gilles on how they are going to put that in place. But we've given sort of the guidance around the mask, but it's not that the only mask to use is the mask that is given out.
Yeah, certainly, and thanks, Dr. Morrison, and we'll certainly have the disposable 3-layer masks at all of our schools and on all of our buses if a child forgets a mask or misplaces one. But again, in terms of the operational piece, Norbert or Jill, if you'd like to respond, that would be helpful.
Well, I can share some of the information for the French board, and I am assuming it's very similar in the English language school board as well, the PSB. We're going to be distributing the mask, and they are being distributed to parents and families today and tomorrow. So we really encourage parents to show up at their schools and to get the proper mask that we're providing, and we will be obviously educating staff and students on the proper wearing of the mask, and we'll be making demonstrations that we're working throughout our different schools to make sure that they wear them properly. And the operational side, our teams have been working very hard to ensure that everybody receives the mask, and our teachers are also aware of the fact that they will be sharing, modeling how to wear those masks to make sure that they're properly worn by all of our students. So we're encouraging parents and families to make sure that they come and get them for the school on Monday.
Okay, and sorry, I just want to clarify on, or sorry, Norbert, did you want to weigh in there?
Yeah, just very similar. The public schools branch does have a masking procedure in place. And, Dr. Morrison has said the best mask is a 3-layered, well-fitting mask. We're not promoting the use of neck gaiters and these types of masks. So we will have triple-layered masks available. And we do want to make sure that parents are and students are abiding by the masking procedures. We do have a virus that's very transmissible, so we will be enforcing the masking at all times, other than the exceptions at the public schools branch.
Thanks, Norbert. And Brittany, if you wanted any more clarification, please let us know.
I think that answers it. I was just going to clarify that if a student shows up with, let's say, a cloth mask that they have used previously, would they be able to stay in the classroom, or would they be given then a medical mask to replace that mask once they got to school?
Norbert, would you like to answer that one?
Thanks, Brittany. And I think it's all about volume, right? On the first day, we want to get people back, welcome to our students, and show them that we're ready and we're safe. So we will have disposable 3-layered masks for that situation. If a mask is not meeting the standards, we can swap that up with one of our disposable ones.
Absolutely.
Okay, perfect. Thank you for clarifying that. And my third question is about the text alerts for parents. I'm just wondering if there's anything more you can tell me about how this system is going to work and when we can expect to see that up and running.
Yeah, thanks, Brittany, for the question. So certainly this has been a phased rollout with our Power School system, and this is a component of it. So I would expect that this will be up and going next week. Yes, we'll issue a press release and we'll get this up and going. And it'll be an opt-in option as well, so parents can choose to. But I highly encourage all families to opt in, because I think this is a great way to communicate around any emergency situation, school closures, storms, which we've seen over the last few weeks, another one coming. But no, I'd encourage families to get involved and look forward to sharing more information on it.
Okay, thank you. And if I could just ask one quick follow-up to my first question, which was about children or families who decide to keep their children home. I was just wondering, I know there is that 5-month homeschool option, but what about for the next 2 to 3 weeks, let's say? Is there an option there?
Thanks again, Brittany, for the question, and I'll let Dr. Tamara Hubley-Little weigh in on this one.
Sorry, can you repeat the question for me? I'm having trouble with my system.
Sure, no problem. It was just a follow-up to my first question, which was about families who may decide not to send their children back to school right away. You mentioned that homeschooling is an option for the next 5 months, but I was just wondering, when it comes to maybe the next 2 or 3 weeks, as parents are watching what happens as students start going back to school, will there be any options in place for the short term?
So to reiterate, I guess, my point about once schools are deemed to be safe and open, we do really want children to come back in. And with that, all of our resources that we've had for remote learning are shifting back to the classroom. So we aren't really in a position to provide those additional supports in this instance. What I would suggest for parents to think about, and I do respect the decision, the very difficult decision that they're making if they do decide to keep their children home. In another couple of weeks, it will be the equivalent of the summer break. with the exception of a couple of weeks of remote learning. And I can't impress upon folks enough when they're making this decision that if there is any way that we can support children in getting them back to school, that we are we want to do that. And student services at the school will support children who are struggling with coming back to school, or if they have those concerns. So to go back to your question though, our resources are going back into the classroom, and remote learning will not be available. We really would like parents to reconsider and but appreciate that it's a very difficult decision that they're making. Thank you.
Okay, perfect. Thank you for the clarification.
Gabrielle Drummond, Radio Canada. Good afternoon to you all. Ma question en français, tout d'abord pour la docteure Heather Morrison. Alors, docteur Morrison, est-ce qu'avec le retour des classes en personne, est-ce qu'on va faire un contrôle sur le statut vaccinal des élèves, par exemple? Est-ce qu'on envisage un passeport vaccinal pour les élèves, le personnel des écoles, même pour les gens qui travaillent dans les centres communautaires, qui sont associés à ces écoles-là?
Bonjour, Gabrielle. Alors, à ce moment, on ne parle pas des vaccins, passeports ou vaccins obligatoires pour les étudiants à l'école. On est en train de mettre sur ligne le nombre la pourcentage des étudiants dans chaque école qui sont vaccinés. Et puis, ça va être, je pense, le plan de mettre en ligne. Et puis aussi, dans 2 semaines à peu près, on va les changer, on va faire un update à ce moment. Alors, ça c'est vraiment on est en train de donner ces résultats aux écoles. Je pense qu'ils sont déjà là pour la commission scolaire de langue française. Alors, c'est vraiment d'encourager tout le monde, les étudiants de 5 à 18 qui sont là, d'être vaccinés. C'est la meilleure façon vraiment de se protéger contre COVID-19 et en plus avec les autres mesures qu'on a en place.
Ma prochaine question, c'est par rapport au système de filtration de l'air portatif. Il me semble que vous avez mentionné que vous allez mettre en place ces systèmes de filtration de l'air pour améliorer la qualité de l'air dans les écoles, si je ne me trompe pas. Alors, comment la santé publique va faire le contrôle sur ce dossier, Dr. Morrison? Quelles sont les écoles qui vont recevoir ce système-là et comment on va s'assurer que ce système, que la ventilation fonctionne bien?
Alors, bonjour Gabrielle, je pense que c'est plutôt peut-être une question pour répondre pour peut-être Gilles ou la ministre. So I'll just repeat the question. It's really around the ventilation systems and the new portable ventilation and HEPA systems that have been ordered by the school. So peut-être Gilles ou ministre?
Yeah, I'll certainly start, but I'll do it in English, and then certainly Jill can comment in French. But yes, there are 11 schools that do not currently have the mechanical ventilation system. So we had ordered and installed 150 HEPA filter systems within the classrooms in those schools. We contracted a specialist to determine, sizing and where it should be located within the classrooms. And certainly there's been staff within the schools that have been trained to maintain these systems. So we're really pleased with those. We encourage students not to move them. I think where they're placed currently is the best place for them. But again, if Jill wants to add some additional comments, please do. we might have lost Jill. Are you there?
Can you hear me?
Okay, there you are. Good, you're back. Is there anything else you wanted to add in French, Jill? Around the HEPA filters?
Can you hear me now?
There. Yeah.
Comme a mentionné, merci Gabriel de la question, mais comme a mentionné la ministre Jameson, les machines à air pour la filtration de l'air ont été achetées avec vraiment une spécificité de faire un travail particulier. On a aussi eu l'avantage d'avoir des spécialistes qui ont venu pour faire l'évaluation des salles de classe, alors ils ont été placés. En plus, on a eu de la formation pour s'occuper pour la maintenance de ces machines. Alors, on va vraiment être en mesure de bien faire la gestion de ces systèmes-là. Il faut comprendre que c'est un nombre minime d'écoles à l'île du territoire qui s'en servent, et seulement ceux et celles dans les écoles qui n'avaient pas de système de ventilation mécanique. Alors, on est très confiant que ça va bien marcher avec ce qu'on a là. Puis, on a fait aussi des tests. Alors, on est confiant que la maintenance, la partie de la gestion va bien se maintenir pendant le temps qu'on aura besoin.
Thank you, Minister. And I will continue with Jill. Alors, Jill, ma troisième question, c'est pour vous. Alors, on avait entendu en anglais, justement, il me semble que la Public School Branch va offrir une option d'enseignement en ligne pour les parents qui sont craintifs, qui ne veulent pas envoyer leurs élèves à l'école lundi. Est-ce que la Commission scolaire de langue française va offrir cette option aussi pour les parents qui ne veulent pas envoyer leurs élèves à l'école tout de suite?
Merci, Gabriel. C'est un point de clarification. Ce n'est pas nécessairement un système d'appui pour ceux qui ne veulent pas envoyer leurs enfants à l'école. C'est ceux qui ne peuvent pas envoyer pour raison d'isolement ou pour raison de maladie. Alors, ceux qui sont désignés ont le système semblable à la PSB pour pouvoir appuyer ces élèves-là. Pour l'option des enfants ou de ceux et celles qui choisissent de ne pas les envoyer, comme a mentionné la docteure Hughie Little, c'est préférable d'avoir une situation d'enseignement en présentiel. Et ce qu'on va valoriser et encourager, on a aussi des appuis à l'intérieur de notre système de service aux élèves qui vont venir appuyer les élèves qui sont peut-être anxieux de retourner au système d'éducation publique présentement. Alors, on les encourage vraiment de venir et de se présenter et de vraiment de travailler aussi sur le côté socio-émotionnel qui est très important parce qu'il y a déjà plusieurs semaines que ces élèves-là ne sont pas en contact avec leurs amis. Alors, c'est important d'encourager l'enseignement présentiel, mais on a aussi un plan en place pour appuyer les élèves qui ne pourront pas se présenter à l'école pour différentes raisons.
OK. Merci beaucoup.
Merci.
Bonne journée.
Merci.
Chien Desjardins, CBC.
Hi, good afternoon, everyone. My first question is for Dr. Morrison and Minister Jameson. The minister recommended parents get students to school themselves. But for those who can't, what are the measures being taken to keep children and drivers safe on buses where children sit next to each other and can't physically distance?
I mean, I think that maybe even Norbert could address.
Yeah, no, that's an excellent question, and we recognize that not all parents can drive their children to school, and we're so grateful for our bus drivers who work tirelessly to ensure the well-being and safety of our students, getting them back and forth from home and school, and certainly we've taken a number of different measures and have equipped our bus drivers with PPE, but I will let Norbert or Jill speak to the operational side of this question. Thank you.
Sure. Thanks, Minister, and thanks for the question, Sheehan. Yes, good question. We do have bus drivers that are having protocols in place on their buses, and it is challenging because you do have a mixture of cohorting happening on buses. However, we do encourage bus drivers to have seating plans. We do tell our students to make sure they're sitting with the same students on a daily basis. That helps in contact tracing when we have to do that. The masking policy is enforced on the bus we adhere to that policy very closely while on buses. The drivers themselves are masked, and with all the other measures that we have in place, we feel confident. Now, in terms of the request for parents, we only do that to help reduce the capacity on the buses, and only during times of, times where we're concerned, right? So we're in an elevated risk scenario going back to school. So if people can help, that's all we're asking, just for a little bit of help, but we're not requesting it as a mandatory thing from our parents.
Yeah. Thanks, Norbert.
Thank you. And then my following question, maybe another one for you, Mr. Carpenter, is in the past there have been issues with staffing shortages due to staff testing positive or being identified as close contacts or having isolate. How is this going to be addressed going forward? How many substitutes have been hired to help cover those staffing shortages?
And we are concerned about that, obviously. From an operational standpoint, we need to keep our staff healthy and safe, just like we do for our students. We are doing quite well. HR team here has worked very hard to add to our complement of substitutes across our work groups. We do have around 300 teachers, certified teachers with a BED, that are supply teachers, and another 126 approximately that can substitute, meaning they do have some credentials. For educational assistants, we have around 240, and we have bus drivers around 56, which is great news, because last year we were in a situation where we only had 20 substitute bus drivers. So we aggressively attacked that shortage. So we do have capacity, absolutely. And I think the numbers will dictate how things go. But at this point, we feel prepared. And we do have other contingency plans in place with some of our post-secondary institutions to be able to redeploy students to help. And same with our own department here at the Public Schools Branch and the department, where people can step into teaching roles when necessary.
Thank you. And then just a final question here for Dr. Morrison. In New Brunswick, when there's a case in a school, the school is closed for what is an operational day to clean the school, etc. When you explain the process here on when to close a school, I just want to make sure, do I understand correctly that won't be happening if there is a positive case in a school, that school will likely stay open?
Yes, hi. And I think you'll see the provinces all making adjustments on what they used to do about cases and close contacts in schools. And they're going to be doing things a little bit differently. And that's really due to the number of cases and the prevalence in the community, but also vaccination rates and the other measures we have in place. So at this point, if there is a case in the school, it would be the notification of everybody in that cohort or class, the increased testing associated with that, and also the contact of any anyone who is deemed close contacts that they would isolate. And but there will not be an automatic school closure based on a single case in a school.
Thank you so much. Have
You're
a great
welcome.
day.
Thank you.
Thank you.
Keith Doucette, Canadian Press.
Hello. No, it doesn't appear like you're tuned in. Maybe if there's somebody else on the line? No, is that the end? Unless you're there? Yeah. Oh, you have another question? Okay, excellent.
Dr. Morrison, it's Allison from The Guardian again. Can you repeat in English the answer about vax passes in schools? And it sounds like there's going to be some data online about percentage of students who are vaccinated.
Hi, Allison. Yes, I'm sorry I didn't translate that particular question. It's the question was around basically whether there was more consideration of mandatory vaccination or Vax Pass in schools, and that is not being something considered at this time for schools. And we've talked about it a little bit before. There have been, for staff, a test or vaccinate policy, but certainly recommending that it's really important to be vaccinated. And there's the vaccination rates for information for parents is going to be online. We've given that information by school in terms of percentage of students who are fully vaccinated and those who've had one dose in that younger age cohort to the public schools branch in the Commission Scolaire Langue Française. And my understanding is that it is going to be posted online, and our office will be updating those rates the week of February the 7th. So really not too long from now, those will be updated with any new people who have been vaccinated at that time. So I don't know if you want to add anything to that, but that's...
No, I think you're absolutely accurate there. So yes, the CSLF has posted theirs, and you can expect the PSB will be posting theirs perhaps this afternoon. So yeah.
Okay.
Great.
And to confirm, those will be at the school board sites, not the provincial data sites, or it won't be included with other media updates?
It's a good question. My understanding is right now it's with the school. We've given that data to the public schools branch and to the Commission Scolaire, and so they will be on their websites by school.
Okay. Yeah. Thank you very much. Merci beaucoup.
Great.
Merci.
Thanks.
Okay.
Unless there's anyone else online? No? I think that's it. Well, thank you very much. Thanks to everyone tuned in, and I wish you all the best in going back to school on Monday. Take care.